meeting called for.
So procedurally, since this is a special meeting, the rules are a little bit different, and to comply with the legal requirements, there are several things that need to take place before the meeting actually gets underway. So first, I appreciate everybody being here on such short notice. So the first thing is that there's confirmation that a quorum requested the meeting. And I think that needs to sort of be the starting point. And I'll turn it over to the chairman to let the chairman maybe inquire so that that can be reflected in the minutes.
Inquire
Whether a quorum requested the meeting. So based on the information that's provided and the topics to be discussed today, that a quorum of the members of the board have agreed that a meeting is necessary.
Yes, I have agreed.
I agree.
So I think it looks like everybody, I didn't see what Don had said, but okay. Second part is the confirmation that the chairman called the meeting.
I did.
Okay. The third requirement, confirmation that the commissioners had sufficient notice to attend, and I see that that appears to be the case because all 5 commissioners are present. And then whether the call was for general business or special business. And just so the public's aware, if they go back and watch this recording, or whoever's present today, that special business has to be tied to particular topics, and the board cannot deviate or go off course from those topics. So from what the notice that was provided, it is to discuss the governor's order and to discuss the local health officer and health department. Is that
Yes.
accurate?
Yes.
Okay. So ultimately, no action can be taken on any matter not covered under what this special session is being held for. And just so the board's aware. Anything else that needs to be brought up?
Not to my knowledge.
I think that covers the special session part of it, to at least get you in the special session. So, a couple of things. Yesterday, the board met and ultimately made a decision to opt out of the governor's executive order. And yes, I'm touching my mask. I just caught myself. But it was falling off my face. As a result of the decision, I don't know if it was as a result of the decision, but later yesterday afternoon, I received notice and a formal letter was provided to the commissioners, and I think the commissioners now have been presented that letter from Dr. Shell resigning as the Coffee County Health Officer effective immediately. And just so it's clear, did everybody receive that and they're aware?
Yes.
Okay. One of the issues to deal with is the local health officer aspect of moving forward, because that's an important role and function. I think it affects the health department as well, but it also is something that is statutorily required by the county to have a local health officer. The secondary effect of that is, Lindsay can correct me if I'm wrong, but Dr. Shell also served as the local medical director which has put the health department at least in a temporary standstill because they operated through his medical license. Is that a?
Correct.
So as a result, the health department can't see patients until that issue is resolved, which may be the more important of the issues that needs to be dealt with or handled or discussed today. That,
Not I interrupt.
sure.
I think you, unless I'm off base here, I think he also served as deputy coroner for the county.
Okay. So we'll have to look into the deputy coroner. I'm not sure if that came. I reached out to Dr. Shell to determine what he had resigned from, and I think he resigned from everything. So if deputy coroner is one of the,
Might want to check that out, but I think that's true.
so that, and that's a good point, and that will have to be looked at, looked into and reviewed as well. But that sort of puts us in the current position. So to me, that necessitated at least the recommendation for an emergency meeting or a special meeting, notwithstanding the issue regarding a resolution prior to the governor's order potentially going into effect. And the second part of why the meeting is today is I had a citizen contact my office yesterday and informed me that I was 24 hours off when the executive order went into effect. And instead of at 12:01 a.m. on Thanksgiving Day, it's actually 12:01 a.m. tomorrow. And I apologize, that's my fault. I'll take the punishment, whatever that might be, but it was an oversight on my part, but we're here today to deal with that particular issue. So, in the interim, I think I might have Lindsay come up and talk about what's needed for the health department to function appropriately to deal with, to meet the needs of what her department needs on the medical director side, because that's probably the big issue right now.
Sure. So I put some information in front of you, not knowing how you guys would like to go forward with anything. For us, the most pressing issue is finding what we've always called to this point a medical director, but I think the statute actually calls it a medical consultant. So I have that prepared in a letter here for you. If you as the commission would like to seek out a licensed medical doctor to perform those duties. And I've listed here what those duties currently include. It's essentially signing some standing orders for us to be able to administer immunizations, to be able to treat sexually transmitted infections and tuberculosis, and to provide epinephrine in case somebody has an allergic reaction to an immunization, as well as our contraceptives. And there's even a head lice treatment that Dr. Shell allowed us to do a standing order for, so we don't have to send people to the doctor for head lice. We have a standing order on a medication we can call in for them, and also for our healthcare blood draws. And these have to be renewed every year. And when we order the medications on here, or when we bill Medicare, we utilize their number for those services. So there is some accountability that needs to be had, but there are standing orders and protocols, and they're all based off of CDC and CDC for the most part. So if you are wanting to take charge of contacting physicians and trying to find somebody for that role, or if you would like me to round some up, that would be fine. I have reached out to 2 to this point, one of which said, if you make it through your list and you still need someone, give me a call, and I'll consider it. And then another one who said that they would let me know Monday morning. So that's specifically for the medical consultant side. So I have that written up in one letter if you yourself wanted to reach out to physicians that you know. I also have included a sample job description that KDHE has on their website. Because Dr. Shell was here so long, we did not have anything formally written when he started 25 years ago. So this is just a sample. It can obviously be changed or not utilized, but in case you wanted to reach out to somebody, that would be part of the responsibilities we are looking for. I guess at this time I would need guidance on how you want me to, or if you need my assistance in finding somebody. Or if you would like to take that forward, and how many candidates would you like me to have to present, or what process would you like to do for this? And I do want to say that in the meantime, we have canceled all of our appointments. At this time, we can do, we can take vital signs on people because that's within our scope of practice. And we can issue medications that are on another physician's order, like allergy medication that we get orders directly from their physician for. We can do that type of stuff, but we can't dispense from our supply of meds.
Nancy, can I ask a couple of questions?
Of course.
Is there any liability incurred by the medical director, or whatever the title is, by your office? Will that transfer any liability to the person whose license you're using?
I would suspect there would be, yes.
And the second question would be, what type of remuneration do you expect to have to pay for the service?
To this point, we have not paid for it.
I know, but I'm thinking,
right.
You may have to.
I reached out to Osage County, our neighbor, who does pay a consultant to do their standing orders. And they only communicate with them once a year. And that rate is $2,800 for the year. We do know historically that their wages are less than, significantly less hourly for their health department staff than what we pay in Coffee County. So that might be a lower place to start if compensation were desired by the person. Or required, I guess. So that's, and I did a little bit of research on malpractice insurance in case we needed to offer that as an incentive that we would pay a portion or a part of a policy, and those prices range anywhere from $25 a month to $69 a month on up to $5,000 a year. So I don't know if part of that would be an enticing offer as well. So I think the specifics of that price really are between the provider and the company they would choose if that's necessary.
Does anyone know if Dr. Shell was getting a salary of any kind for being coroner?
The coroner, Dr. Shell was deputy coroner, and my understanding they didn't get any compensation, as well as the other doctors were then deputy coroners under him as well.
Under him?
Yeah, under him.
He's not the only deputy coroner.
He was the deputy coroner, and then they were subsequent under him. If he wasn't available, then one of those doctors, he could appoint one of them to step in. Usually it was the on-call doctor for the ER. But they never got paid anything, to my knowledge.
The two that you reached out for, are they in our coffee health systems? Are you trying to reach out to somebody that's
Yes.
close by?
Oh, yes, absolutely. And
Are the doctors the only one to be qualified to fill that position?
yes, they do need to have a medical license for the medical consultant.
So one of the statutes I went over yesterday, actually sort of talked about this a little bit. It's KSA 65-201, which talks about at least the local health officer, which I think would probably be similar. And within that particular statute, it says County commissioners shall act as the board of health for their respective counties. Each county board shall appoint a person licensed to practice medicine and surgery, preference being given to a person to a training in public health who shall serve in an advisory capacity to the county board of health and as the local health officer. So if you go back, a person licensed to practice medicine and surgery. Now this statute further goes on to state that in a county with a population less than 100,000, the board may appoint a qualified local health program administrator as the local health officer if a person licensed to practice medicine and surgery or other person licensed to practice dentistry is designated as a consultant to direct the administrator on program and related medical and professional matters. Both serve at the pleasure of the board. So I don't know if the dentistry one is interesting to be added in there, but that is, and in other counties, I think they appoint someone in a similar position to Lindsay as the local health officer under that caveat that there's a consultant. So that's just an FYI, and that's KSA 65201, the statute that I just gave.
So at this time, do you guys have any direction on how you would like to go forward in obtaining a new medical consultant at least?
You stated you reached out to a few individuals already, and we're waiting to hear back their answer. Is that correct?
Two. I have one that will give me an answer on Monday morning.
Do you agree that it would be best off if it was that individual would be from Coffee County Health System, so to speak? Or does it have preference to you? Does it matter?
Oh, I have no preference at all.
My suggestion, in my opinion, I think it'd be best interest to have somebody from CHS, if somebody from CHS is willing to take that position.
Absolutely.
The two you reached out to, and I know you probably don't know, did you get a feeling that they may accept the position?
I don't know what
Too
they're
early to
thinking. I know they wanted to talk to Dr. Shell about it. Both of them did, to make sure that everything was good there. And so that might be part of the piece that we're waiting on. So.
Wait, if I may. Basically the last paragraph in what you handed us.
Yes.
Any county having a population of less than 15,000, a contract with the governing body of any hospital located in such county for the purpose of authorizing such governing body to supply services to county board of health.
And that is an option within the statute. I didn't bring that up because historically that's not been, there's been a designated person.
Well, we're in a new part of history, or
Sure.
the code started in March, so.
I understand. I'm not sure, I mean, that would have to be explored and looked into. I think in the interim, whatever is decided, long-term, there needs to be at least a temporary solution, because one of the questions I was gonna have Lindsay answer is there an impact now with the resignation of Dr. Shell to the COVID protocol, which if there is, I mean, that's its own thing. And I'll let Lindsay answer that.
Okay. So impact to our COVID protocol. So we can operate under the disease investigation guidelines and the authority of Secretary Norman to continue our disease containment efforts. However, when it comes to testing, if you were a contact and if you were symptomatic, we were able to get a test done at a specific time and location, and Dr. Shell would authorize those. And at this time, we don't have a physician that can authorize those, so we cannot get people tested quickly. We're having to refer them to their own physicians, which is fine. It's an option. It will have to work. But as far as quarantine and isolation, we can continue that as we were the day before yesterday and the day before that. So at this time, it's really the services that we're reliant upon that license for us to continue to operate to serve patients. So, for the majority of our patients.
You have a list, or basically we know every doctor in the county, so I mean, you've gone through most of them already.
I've gone through 2.
Okay.
So, I mean, that's what I'm here for. How do you want me to continue doing the outreach, or would you guys like to take that yourself? Is there a certain way you would like to go about this? I wanted to come here with somewhat of a plan, but also it's your decision on how you want it to go. So I'll be glad to do what you guys wish.
Since you've already made an initial contact, I think you should proceed.
I concur with that. I mean, I do too.
Okay.
I mean, you already reached out to these 2 individuals, and one of them's already said, if you know, I'll give you an answer come Monday. I mean,
Okay. Do you want me to
5
stop
days
at 1,
away.
or do you want me to give you options?
I would say the more options we have, the better, but in my opinion, no.
Options? Okay.
I mean, there's several that practice here, so,
Yeah.
I mean,
How should I address compensation? Should that be something that's discussed as here's our price, here's what we would offer, or should that be a negotiated thing later?
I think you should ask them if there's remuneration required.
so I mean, Dr. Michelle's been doing it at no fee, so,
Right.
I guess that would be up to the individual if that's what they require. In my opinion, again.
Okay. So I think I have some direction on medical consultant. So now, as far as health officer goes, I think I want to be clear to the person that might eventually become our medical consultant, that these 2 can be separated. I know right now being a local health officer is probably not the most wanted job in America right now. They're probably in one of the hottest seats. Actually, one of the scariest jobs to have right now. So filling that might be difficult, but again, we need to try.
Yeah, I agree, but the director or the medical consultant is top priority, and that the officer would be a second priority for me anyway. To get you guys back up and running where you need to be. I mean, heck, we can appoint you to health officer.
Right.
If we so choose, but.
Right. And I mean, I'm open to that. I think we would need to be clear that we would be working towards getting a position back in that role in the near future. I mean, I would be glad to serve as interim. I'd be glad to do it long term. It doesn't matter. I just want you to know I'm not advocating that has to be me. Completely willing for that to be anybody that wants to do it.
Yeah.
The only other option, and I'll throw Carl under the bus here, is, I mean, he is part of our staff. If he became a deputy administrator, he could be health officer as well. That's how some counties do it. Or one county does it that way. They have a deputy administrator and they're the health officer. So, sorry, Carl, sorry. But we do have some options. So we can try to find a health officer. I have had somebody offer to do it that is not a licensed medical physician. They are a licensed veterinary medical person. They wanted the job a few months ago when things were really heated. I don't know that they meet the qualifications outlined in statute. So, because it clearly says licensed medicine and surgery. So,
What's the pros and cons of having one person doing both versus 2 separate? Is there a plus to having one person doing both positions for 2 people?
I would say it's definitely been smooth sailing since I've been here in 2007 by having it be one person.
To me, if you can find the right person, to me, that'd be a plus.
Absolutely.
But that's the reason I asked if there's a plus.
Would that be?
The con to it being one person is that we might not find somebody to do it.
Yeah.
So, it might scare people away from being medical consultant and health officer if they have to do both, just because health officer is so, I mean,
With all due respect, it's been pretty hands-off till this year, so I mean, we haven't had really much to do
Smooth
with it
sailing.
till.
smooth sailing.
Yeah,
There are times throughout the year where we might have something weird come through with immunizations or some type of medical issue that we need to call a doctor on, and Michelle has been able to fulfill that. They're very few and far between, but, so as far as health officer goes, how do you want to handle that one going forward? Do you want to reach out yourself? Do you want me to reach out for that? What do you want to do?
We need to do that pretty quick, and it's my understanding there's 2 or 3 options. Do we need to go discuss those options and maybe come back and make a temporary decision, or?
So, and a decision needs to be made sooner rather than later, because that's an important role and function with the county now. We're here 24 hours, in essence, after the resignation, so I would say that the county is moving rather quickly in determining what the best option for the county is. There are 3 options on the table. I don't know which is the best option and what the available options are. As Tom indicated, the last option is to check with the hospital to see. I don't know enough about that. I've not had a chance to research it enough to get, I'm barely even.
well, I mean, when I read that last paragraph, I mean, correct me if I'm wrong, we contract with the hospital itself. Is that not the way I'm reading that?
No, that is, and then they would provide.
They provide us with what we need.
Right. But they would have to agree, and there may be some sort of compensation factor that goes with that, which we wouldn't know. I mean, that would have to be a contract.
Well, again, with all due respect, I mean, they have a loan with us, so.
Sure.
I think negotiations is on the table.
We just wrote off $1.5 million.
I think negotiations are on the table.
It might also add
I don't
another
think that-
layer, yeah, it might also add another layer of politics as well.
Yeah.
Just throwing that out there.
Every option right now is on the table because there's not an identified option. So
Well,
I would agree that each option needs to be explored, but in the interim, there needs to be something put in place to get us to the point where
To that point.
a decision can be made.
so do we need, if we choose this latter option that I just brought up, I mean, do we contact the CEO of the hospital? Do you contact the CEO of the
So
hospital?
they need to be brought on board, and then we need to see sort of what the mechanics of that would look like. Hopefully, there's another county that has utilized that particular statutory provision. And I'm willing to look into that. I don't have any problem with that.
Now I'll go back to Lindsay on this then. I mean, having thrown that out there, what do you see? Do you wish to pursue? Because basically this is your department, in my opinion, again only. Do you wish to pursue the way you're going, contacting doctors, or does it matter not to you?
I am at the mercy of the board. I will do whatever you want. I do see an added layer of
Complexity?
yeah,
Okay.
with that. I've never heard of a county using that option. I don't know, Tina,
Morris County,
who?
Morris,
Morris County does that?
yeah,
The
Morris
hospital
County,
board?
Morris County contracts through their local hospital, Morris County Hospital. The local health officer operates out of there in Canada. Ed is the health department administrator in Morris County. So she's an employee of the hospital, is how that's arranged. That's the general nature of it. Now, how it's all detailed out with the county, I have no idea. But that's the county in my region that I take care of, it does.
Okay.
Who does it that way.
Thank you.
I'm not too sure that would be the best option to go to. But you need something quicker than what that's gonna take place to move forward your department, correct?
They got a board, no mean to interrupt, but just my thinking only, they got a board just like we're a board. They can call meetings just like we do.
They met last, I understood they met last time.
Just thinking out loud. I don't know if that's the correct line of thought or not, but correct me if I'm wrong.
I'm not sure the board would know the logistics of how, I mean, they can give the thumbs up or thumbs down on whether that's something that could work, but internally, how that would work and a contract and for what type of services, that may require some administrative help and then to see if their administration to their physicians and staff are even on board and willing to be a part of this particular endeavor. And I don't know that, they might be, they might say, yeah, sure. Or they might say, well, no, we're dealing with our own issues right now with COVID and we don't have the resources to do it. I don't know. I mean, it can be looked into.
If the responsibility were spread out in their organization, similar to the coroner situation, and then it's whoever's on call, our answers could be different every day. So when Dr. Shell was able to make certain rules when we needed them, with the next call we make, reverse that rule. And with the next person we call, know the rule that was already made. So that would be my question, is how day to day would that work? I don't, logistically speaking, I don't know.
Okay.
Yeah.
That's why I asked that question.
Yeah,
What kind of
I don't know.
complexity do you see? So.
Yeah, I don't know.
So to even name, if Lindsay or Carl or somebody in that department were to temporarily be named the local health administrator, you still have to identify the licensed physician that meets the criteria to be the consultant. So we're sort of, even if there were, I think she could say in theory that the decision was made to appoint Lindsay today to temporarily hold that position, you still don't have a physician.
Right.
And the physician part is, at least by statute, one of the key requirements. And that needs to be solved similar to the other medical consultant question. So it's a lot of information moving fast, but there was not time to delay this particular decision to next week. It's part of why we're here. And I need to backtrack just a little bit. Notice was provided in accordance with the statute to everybody who receives notice. In my understanding, there's a mailing or an email that goes out to a number of identified individuals who request to have notice of county commission meetings, including the paper, and I don't know who else on the list, but that email went out this morning, and I just want to make sure I didn't state that earlier.
Yeah. So what's your terminology? We just need, you say we need to appoint a health officer and be looking for a consultant while we're.
He defined the medical consultant as top priority because that significantly impacts the operation of our health department.
Well, I guess where I'm backing up to is I've heard consultant, director, and officer. So sure, is the director and the consultant pretty much the same?
Yes, I changed the language from what we've always used to what the statute what the statute says. So.
And then the local health officer is separate.
Right.
Same as local health administrator.
So when Dr. Shell talked to us yesterday, in what capacity was he talking to us under?
Health officer.
Local
Health officer.
Mm-hmm.
And I tried to figure out when in time, and I think I asked the question yesterday, how long has he been the local health officer? It goes back several decades, that's my understanding. And I was just curious what the formal process was to place him in that role and start operate in that capacity. I still not got
He,
that far.
he said when Dr. White passed away, he was asked to do it.
Okay.
So he did. So whenever that was.
Been a ways by.
Mhm.
So who's to say that paragraph, last paragraph, there isn't a contract setting up there that nobody knows about? If White did it and he just did it, I mean, is it thinking out loud, maybe I shouldn't do that sometimes.
So that your office can function, though, you need a health officer in place.
Um,
PDQ, I wonder if there's one of these contracts that you made or will make, would temporarily do that without taking a permanent position.
you mean the
And so you could still function.
medical consultant is what's keeping me from functioning.
Right.
So I don't know. I can ask, but I don't know.
That would be, I mean, we've already got one that said they let us know for sure 100% Monday, but how detrimental is it from now till Monday, fairly? I would
Well, I mean, we only have one more business day. You know, it'd probably take us that long to get everything signed and back in place, so,
Okay, so waiting till Monday is not a major issue for this consultant.
no, because we've canceled everything through Monday at least.
And you can still do your COVID tracking.
Oh, yeah.
This and that, yeah.
We can do that.
Well, there's been a lot of things discussed, but I know the medical officer is the most important, but I would encourage us to have someone besides the county employee as health officer.
So do you want me to put something out to all of the physicians in the county? Or do you guys want to do that?
You pretty much in direct contact with most of them anyway, are you not, or?
There's a few that I don't have access to, but I could probably get it.
Have to put more on your plate,
Okay.
but, I mean, that's just my thinking on what everybody else thinks.
How many doctors are officially under CHS, full-time versus part-time, coming in a day here, a day there?
Like 8 to 11 somewhere around.
How many?
8 to 11.
Maybe 8
8
to
to
11.
11? I figured maybe 7 or 8.
I'm not sure.
So it wouldn't take, well, it'd take time, right? Your plate's loaded.
Yep, but I can.
To me, you might be the best contact person because you are a health officer here.
Mhm.
And would be able to answer questions they may have that we wouldn't be qualified to answer. Or I don't feel like I'm qualified.
If any of you have relationships with physicians, I encourage you to reach out to them and ask them to consider it or to reach out to me. So I think that would be helpful.
Yeah.
Okay, so,
And I don't necessarily want to disagree with Fred, but I'm not sure that a local employee wouldn't be a bad deal. I mean,
I think it'd be more,
without thinking really discussion on it, I'm not sure that wouldn't be an option, something to look at anyway.
I think there would be more neutrality and less political influence if it were not.
okay. All right, I have my notes, I have my instructions, and I will go forward and do that. So if I will present to you as many people as I can that are interested, and we'll just take it from there.
And if you find anyone overnight, we're gonna be here tomorrow in the morning.
Okay, I'll do my best. I will do my best.
And would it, you didn't like the complexity of the contracting with the hospitals?
We could,
It's, I don't know, for some reason, I don't know why it's just sticking in my mind here.
who is their board chair?
I think it's Jody Thomas, isn't it?
I think
it is right now.
I'm not sure.
I'd have to look.
But they would have to meet because they're just like us. One person can't make a decision. And they would have to talk to their CEO and all this. So, I mean, it's not gonna happen overnight. I mean, it's not a bad idea, but it's not gonna happen
Neither
overnight.
is the other route either, but I mean, it's,
It
It gives
wouldn't
us
hurt,
another option
Yeah,
to maybe to look at.
it wouldn't hurt to lay the
Not
groundwork
saying
for
we
it.
have to do that,
right.
just,
It wouldn't hurt to lay the groundwork for it, because you don't know what the new CEO has been involved in the past. There may be something that will tie that thing together right quick.
Yeah.
And that may be a wish list, but you don't know what's out there.
And then maybe that if either Tom or one of you could reach out to the CEO or the board chair and ask, hey, I don't know.
just make sure that's okay. Waive.
I mean, I don't know. It's an option.
For you to reach out?
I mean, just to talk and see if they're familiar with this particular situation, so to speak.
I think if you do it individually and then it's not discussed, I don't see an issue with it. Or
Not like I'm gonna go cut a deal or anything like that, just kind of speak and say, hey, have you
Feel
ever been involved in such a situation? So,
right.
what was my thinking? I don't wanna do it without the rest of the guys' approval though.
I think we need to discover every option that's out there right now.
Right.
To maximize benefits.
Create
to
an
the
option,
county.
let's take a look at it. We don't want to bar and bargain with everybody in there.
Hmm.
We don't want to bar and bargain with everybody.
Yeah,
So that's two of the things that were to be discussed related to this special session. The last thing is the resolution order related to the mask, the governor's mask mandate. So I put together a sample resolution, but I don't have one copy, so it might be best to get a copy so everybody could have it, and I apologize. I also apologize for my attire.
oh, I have to too.
You're fine.
Yeah,
I originally wasn't gonna be working today, so
I wouldn't either.
I dress casually. But it's important to me to dress professionally when I'm in front of the board because in my mind, that's what the county citizens pay me to be a professional, and I dress like a professional. That's just my opinion and how I feel I should be present in this setting.
Fine by me.
So as I guess while we're waiting, the governor's executive order states effective at 12:01 a.m. on Wednesday, November 25th, 2020. And in my mind, the days were, I was 24 hours off. And I don't know how it happened, but we're dealing with it now. So I know the board is meeting tomorrow, and I checked with several other of my cohorts who are also serve in the same capacity. And the general consensus is that the county's gonna opt out. It has to be done prior to when the governor's executive order goes into effect. Now, there's also some outliers that say it can be done at any time. To be on the safe side, that's why it's being brought up and addressed today. If that's still the intent. Any questions, anything that needs to be addressed in relation to that?
If there's a resolution to opt out, I probably will not be able to sign it.
Okay.
Probably will not, what, Fred?
I probably will not be able to sign the resolution.
So that's why, if that's the board's decision, you're still part of the board.
I still have a vote, and that's my vote.
You did the votes yesterday, and that was a board decision. I don't always agree with the board, but if the board makes a decision to do something, I jump on and go with it and support it.
Well, what are you saying is 3 out of the 5 approved or voted to do that? You wouldn't want to 5. One, 3, 2. One keeps calling down, I gotta touch it.
Or you want me to help on the ones out?
Thank you.
Wade, is Dr. Shell's resignation an open public record, or is that something that the person can look at, or? I don't know if it's allowed or not.
You just went around and corresponded.
And it's through the board county commissioners, so I assume it's public record. If you want me just to read it?
It doesn't matter, I just thought I'd like to look at it.
It says, I, John Shell, your current volunteer Coffee County Health Agent, do respectfully resign effective immediately. If there are any questions, please contact me at 620-364-5395.
Has anybody reached out to Dr. Shell? No, I mean the board.
I have not. With that being said, I would, I'd like to say, I mean, yesterday we were standing here talking, we were here talking, and, you know, the statement was made, you know, I kind of felt like we had to make a decision right here now because the paper comes out today. Well, sometimes I like to think a little bit longer than a few minutes to make a decision as such we made.
And the reason I ask is I just feel a storm brewing here, like with what's going
Yeah, me
on.
too.
And I had a number of citizens stop me today that felt like, and they're upset with the commission, that they felt like Dr. Shell was disrespected yesterday.
I can get that.
Whether it was intentional or not.
No, it meant no disrespect on my part. I can see why he would resign, with all due respect, because we didn't back him.
Sure.
But, I mean, not everybody sees eye to eye on any situation.
No. Anytime I've had an employee resign or whatever, I usually try to sit down with them and go over, you know, and try to resolve where there may have been inferences or, you know, people reading into it. I just don't know if there's an attempt to repair the relationship or not. Because he is part of Coffee Health System, and we were talking about doing Coffee Health System and potentially putting that board in a position that while they recognize the financial gratitude to the commission, it may put them in a position that they need to back their physicians also, their staff, because if not, then I just see this storm brewing, I guess, is what I'm saying. And I would rather try to repair a relationship versus tearing one down. Because Dr. Shell is very highly thought of in the community. He doesn't cry wolf. And I felt like he was disrespected, in my opinion. I thought it got too animated and loud, and it just wasn't a good experience. And so regardless of what decision you make as a board, I feel like somebody needs to reach out to repair that relationship, because the long-term ramifications, our citizens could pay for that. Not us necessarily, or maybe us, our family members. I just feel like it's a very important relationship to have, that to just set it aside and hastily move on versus trying to at least reach out. We've got time. It sounds like in the meantime, shut up.
No, I get what you're trying to say, but
I just think it's too important of an issue that the citizens of our county are speaking out. To me, probably half a dozen people stopped me today.
I spoke to half a dozen myself.
And there's people the other way too.
Glad they don't.
And to me, I guess that's why, I would say we're not enemies in this, we're Americans.
Yeah.
We're Americans. We're not enemies,
No.
we're Americans. You know, I fought for that freedom just like others have. And we should respect each other's opinion. And I just feel like somebody needs to reach out to Dr. Shell, if nothing else, to repair the relationship and move on. But to just leave it the way it is, I just see the storm brewing. And that's
I wouldn't plan on leaving it the way it is. I just know a situation occurred quick and fast.
And it's unfortunate.
And it's unfortunate.
It is.
And, yeah.
We'll find we're not the only county that stops it now.
Absolutely.
Yeah, there's two in Osage and another in
Osage and Lynn and Anderson.
Anderson haven't yet, maybe they have.
Yes, they have.
They did.
Yes, they have.
I've seen Osage and another did.
And I respect people that have different opinions, one way or the other. I fully respect both sides of this.
That's where you reach a compromise and move ahead. This is kind of a tough deal to reach a total compromise on.
What's best for our citizens.
I go back to, we felt like we had to make a decision when the newspaper comes out.
It was pretty rushed. I agree.
It was rough.
It was.
If I could add that if we are going forward with talking to the hospital, that repairing that relationship with Dr. Shell is imminent because he is chief of staff there.
Mhm.
And I mean, I know you talked about this last night at this board meeting, so I feel like Randy is absolutely right in that.
No.
So,
And I agree, we should,
absolutely.
we should.
And I think you would find in this order, we have taken everything out of the governor's order that we can, that we felt fit Coffee County and you guys' intent. It just doesn't say require. It says recommend. And I didn't include. So I guess what I'm trying to say is I'm trying to find a middle ground that, while it might not be a mandate, it includes as much of it as it could. I didn't include sitting and waiting for transportation because that's not an issue in Coffee County. We don't have people sitting on bus benches waiting, so I didn't feel that applied. But everything else is from the governor's order. So,
This is one of those issues or decisions or whatever you want to call it. Technically, there's no middle ground. It's actually one way. The middle ground is a pretty small area.
After the meeting, I mean, I've had more contact with Dr. Shell in the last 6 months than I've had with any doctor in the last 10 years. And it's mainly related to COVID and I've worked with them regarding the local orders when there was a local order shutting things down, and worked with him heavily on that particular issue. I worked with him on several other issues. So I formed what I would feel is a solid professional relationship with him, which I think that's the way it should be and how it should be regardless of whatever the outcome is. I will tell you, he wanted to know after he got off the phone and after the meeting was over, what happened. And I was the natural person for him to ask that to because I had had these conversations with him regarding if this is what he wanted to do, what his wishes were. And I had a short phone conversation with him and told him that the commission had decided to opt out, and he was surprised and didn't realize that could happen. And at that point, he indicated, where do I send my letter? So it had to be a potential no outcome.
I understand his, I really do. I can understand his frustration. I mean, be like, one of my foremen's telling some guy he's fired and then me saying, well, hell, you can't do that, take back to work. I mean, it is the same, but it isn't. But by the same token, like I say, yesterday, sitting here and listening to you saying, I don't need more court cases. I've got court cases lining up with
Sure.
battered wives and drug dealers and this and that and the other. And Lindsay's saying, who's gonna answer the phone 24/7 while somebody's tattletaling and this and that and the other. That's what I based my decision off of. It's those two situations for you guys right there. And I'm not saying I made my decision based just for you guys. I'm just saying I could see this snowballing in your court. I could see this snowballing in your office. You're already booked. Randy's probably busy enough because he's got to arrest the drug dealers and the battered wives and all like that. So
I'll agree with that 100%.
I mean, I was just, in my opinion, I was taking stress off you,
Sure. And
you guys.
ultimately, the decision is the board's decision. And, you know, as it relates to what happens in the county attorney's office, I've got the magic word on anything that I do called discretion. And that discretion allows me to handle any case in a given way.
And I'm not saying you couldn't handle it. I'm
Sure,
just saying,
no,
your
but-
comment of your courts are full now, her phone's busy already, she's busy arresting the people, you gotta try, and that's, again, at the risk of repeating myself, that's why I based my decision on what I did.
and it is an issue. And the word that comes to mind is division. Because there are two sides to this story. One side that feels that face masks should be worn to help mitigate the spread of COVID. And then the other side that either doesn't feel that masks are effective based on whatever is out in the media, and that it's an infringement on their individual right to make that decision themselves. And it's a no-win because of that division. Our nation is divided. This is an issue that is dividing our county officials, and at some point in time, there has to be a push for unity and for everybody to respect the other person's opinion and to attempt to meet in the middle. And there is no right answer. I mean, in this situation, it's either it's one or the other. So it is a no-win situation. And I get that. And I don't envy your position, but that's why I laid out what the law says so that you know.
Take a look at this.
Or,
Is that correctly what that's supposed to say, or should it be in effect?
I will say, during the summer, I came across a director at a long-term care facility similar to the Meadows, and she appeared to be in the Kansas City area. And she talked a lot about the stress of, is it right to lock everybody down in the facility? Is it right to let them do whatever they want? Like, finding the happy medium, there just isn't one. There's so much division over that. But she finally came to the conclusion that each resident could choose for themselves what they wanted to do. So there was no wrong decision. Every decision was right for that person. And I think that's really stuck with me through this time because, I mean, if I were queen for a day and had my own nursing home, I would have a wing for people that want to do what they want to do. I'd have a wing for people who want it locked down. And I would have both operating at the same time. And I think there is a happy, I think there can be a happy medium. There are businesses here that don't require masks. And if you don't want to go there, don't go there. And that's, I mean, it's that simple. If you want to go to a business that requires masks, go there. If you want to wear your mask, wear your mask. I mean, to me, that's where the middle ground is forcing it on someone as government mandating it. It does put us in a hot seat. It really, really does. And we can take it, we've taken it to this point. But what really got me yesterday was when Dr. Shell said, this isn't going to work. He said it himself. I think it was somewhere around the conversation where Tim said, don't you think we already have the people that will wear masks? Don't you think? And I think even Randy even said that too. People don't wear seatbelts, people speed. This isn't going to
A
work.
seatbelt, so they're gonna kill themselves and not, or this area you're exposing
Not
other
necessarily.
people. Pardon?
Not necessarily, they may
Well, you may
bounce
kill
around the
someone
car.
else, because the first objective, you're gonna hurt yourself. In this situation, those that are not wearing masks got more opportunity to expose others that are trying to wear a mask, because the mask doesn't guarantee you don't get it.
Right.
Although it is supposed to be a little bit of a safety factor in most states.
But putting restrictions on healthy people is known as tyranny. And that's inching towards that, in my opinion. Just mandating it is inching towards that for healthy people. We know the very first research that came out with masks, the very first, before they were even an issue, it said, you are more likely to touch your face. That's the first research we had. And I would challenge anybody to go to Dairy Queen after this meeting and order a blizzard and watch the person wearing the mask and the gloves and how many times they touch their face and then touch your cup. No offense to Dairy Queen, love them, go there anyway. But that's just one example, and like with Wade and saying, it actually might increase the risk to touch your face more.
I'm not sure I've been in any business that hasn't done exactly what you said, that's wearing a mask.
Right, and I'm not,
Taking my credit card or scanning my food, whatever.
yeah, and I'm not trying to convince you either way, I'm just saying that I do feel the middle ground is for people to decide what works for them. Just based on that lady in the nursing home, she finally felt at ease once she let each resident make the decision for themselves. And then it was never a wrong decision from that point on. If Bob wants to go meet with family, that's his prerogative. And if you want to stay in your room and not, that's your prerogative.
That's everybody's right choice.
Yeah.
And unfortunately, our local nursing homes aren't doing that.
And I agree with you 100%, because I talked to some commissioners, I touched my mask again, but a couple other counties, and basically theirs was the same reasoning that mine was, is we're not going to mandate and tell people they've got to do this. Let people use their own common sense. And I think the people that are gonna wear the mask are wearing them now. The people that, if we mandate it, they may, and they may not, but I don't know.
Yeah, and we know that this virus takes some time for two people to spend together in the same space pretty closely. So if you think about the interactions that occur in our businesses in Coffee County, that's not a lot of our businesses. If you're running in, or if you're going into Casey's or going into Christmas or the bank, it's usually not a 10-minute transaction where you're within 6 foot of somebody. It's usually much shorter than that, and even more distance than that if you want it to be. So, we don't quarantine people just because they were at Casey's at the same time, because that's not how the disease spreads. That's what KDHE tells us. That's in the CDC guidelines even. So anyway, that's beside the point. But I just want you to know that what I tried to put in here, I was hoping to be a middle ground, and I'm not sure if that was met or not, but it was as close to the state guidelines as could be.
There's 17 people in this room right now, and all 17 are wearing a mask. So everybody who's here made a choice to wear a mask. Now, if they didn't wear a mask, are they going to be turned away? No.
Like if somebody here that's not comfortable with it, could probably ask them to leave, because it is commission chambers, I would assume.
Sure, but everybody consciously made the decision to wear a mask, which I think is, I've almost got the one that I have on sewed to my head now.
And if the business owner wants to request that a person coming in needs to wear a mask, guess what? they can't.
That's their prerogative, and other places, if you don't have a mask on, you don't get to come in. Now, I've seen that in certain places, and people completely walk by the door, and it's not enforced, so, I mean, but if you go to Topeka, I think the majority of the places in Topeka, you have to have a mask, and
No different than a shirt.
so,
And, I mean, if you look at that as an example, that, if it can't even be enforced in a small business, how are we going to enforce this on a county level?
It can be enforced, not for the mask wearing, but for failure, they'd be asked to leave, and if they refuse to leave, then it could be considered criminal trespass. That's how you,
I am fully.
but I know what you're saying, I know what you're saying, and
For instance, Dollar General or Casey's, where they have signs up and people don't.
I think Hoover's mandates masks now.
They do. They turn you away if you do not.
Do they?
People in there without masks.
I haven't been in there for,
If they ask them to leave, so.
Were they allowed to check out?
I can't answer. There was people in there yesterday without masks, because I was in there for 30 minutes.
yeah, I was just trying to tell you, that's what we would do if somebody calls us a business and there's a problem or whatever, then that's how we would deal with it.
If there was a business and didn't
Yeah.
want anybody in there without a mask on.
Yeah, that's what we would do.
You bet.
We just ask them to leave. It's not a mandate. The
It's
business has a
mandated
right.
For you, you can go in and do what you want to up there, and there'll be 4 or 5% that will have masks on. And it's a mandate on the board.
Yeah,
But they won't, evidently, they don't meet them at the door and ask them. There's no greeter to door like we used to be here 6 months ago, offering you a mask.
so,
But I know in Blue Stem or Walmart or Ace Hardware, it was, I was in for it for them. They're not enforcing it, they're enforcing it, even though it's required by the city council.
and that's pretty much how we would
See, that's
handle
my
it.
point. Why have a law if you can't enforce it? Or if you don't have the ability to enforce it?
And that's how we'd handle it if it was a mandate. It's a civil issue. And the fact that then we basically handle it the same way, ask the person to leave, mask are mandated. And then if they refuse to comply, it depends on how they respond and we respond but the violation itself is not arrestable.
In Emporia, most of the businesses will not ask you.
I ain't arresting nobody for it.
Complains.
Yeah.
If they get a complaint, then they will ask that party to leave.
Yeah,
But until then, they won't.
right.
so it is enforceable, and I demonstrated that through what the law says. There is an enforcement component, but that's where discretion comes in. And,
I'm just glad we can have these conversations and not, you know what I mean?
You want me to jump up and down and be screaming at you or something?
Exactly. No, don't.
I wish you would.
It's nice to be able to have a conversation and,
Yeah, it is.
to engage in this dialogue and respect each other's positions.
And that's why I go back to say, I
I agree.
get Dr. Shell's point of
Yep.
his recommendation, I really do, but
To me, it becomes pretty personal,
It does.
this
Just
instance,
like that.
because we all are doing it.
Right.
Wade wishes to finish up.
Yep.
and I'm here for the day now. So.
And I apologize for that.
No, that's fine. That's why I'm
The
here.
day off, I'm sorry.
But you know what? This
We gotta
was
be-
important, and it was an emergency,
This
and I
something
needed
had
to be here.
today.
Wade, thank you for being here.
No, that's, my duty is to the county and to the citizens of the county to do my job, whether I have a day off planned or not. And I'll be here when I need to be here. That's just the way it is. It's what I signed up for, and that'll happen each and every time.
I think we're all lucky to have you, so thank you very much.
Thank you.
Mr. Chairman, I guess I made the motion yesterday to opt out. I will make the motion to pass resolution. I don't know what the number is.
Should be 8:20.
863, do you want me to go through it so that, and there's gonna be people
should.
watching,
Let's do.
there's gonna be people watching, so I know it'll be published in the paper at some point, but between now and then, it may be a few days. So to know what it says. So I will say, then I'll let you know where I've made a couple corrections, because I'm gonna have to have it reprinted. I'll start. Resolution number 2020-863, an order exempting Coffee County, Kansas from Executive Order number 2068, an order by the governor of the state of Kansas establishing a face covering protocol. Whereas the governor of the state of Kansas did on July 2nd, 2020, issue executive order number 2052 requiring masks or other face coverings in public, and said order became effective as of 12:01 a.m. on Friday, July 3rd, 2020. Whereas pursuant to section 33 of Kansas House Bill 2016 as codified at KSA 2020 sub 48925H, the Board of County Commissioners may issue an order related to public health that includes provisions that are less stringent than the provisions of an executive order effective statewide issued by the governor. Whereas on Monday, July 6, 2020, the Board of County Commissioners signed an order exempting Coffee County, Kansas from the requirement of masks or other face coverings in public in resolution 2020-855 pursuant to section 33 of Kansas House Bill 2016 and to be codified at KSA 2020 sub 48925H. Whereas the governor of the state of Kansas did on November 18, 2020, issue executive order number 2068, establishing a statewide face covering protocol, and said order to become effective as of 12:01 a.m. on Wednesday, November 25th, 2020. And whereas pursuant to section 33 of Kansas House Bill 2016 and codified at KSA 20 sub 48925H, and in lieu of following executive order number 2068, the Board of County Commissioners have decided to issue an order relating to public health that is less stringent than the provisions of executive order 2068 effective statewide as issued by the governor. Whereas there have been 267 total positive cases and currently 24 active cases within Coffee County, and that should have COVID-19. Now therefore, be it ordered by the Board of County Commissioners pursuant to the above authorities and findings that the following rules will be in effect for Coffee County. And you need to determine whether that's effective immediately or at 12:01 or whenever you want. It says effective immediately, but I think you need to make that determination. 1, Resolution 2020-855, passed by the Board of County Commissioners on July 6, 2020, is hereby rescinded. 2, the board has consulted with the local health officer concerning the requirements of the wearing of masks or other face coverings as in public as mandated by Executive Order 2068. 3, after consultation with the local health officer, the board, and strike out the next part from comma to comma, the Board of County Commissioners have determined that the implementation of the provisions contained within Executive Order number 2068 requiring enforcement and mandating masks would be difficult, if not impossible, and would be an unreasonable strain on county resources such as PPE. 4, the Board of County Commissioners find there is a broad range of recommendations other than the mandated mask wearing requirements set forth by the governor in Executive Order 2068, and that other measures related to the safety precautions and protocol necessary to fight the potential spread of COVID-19 better serve the local needs and interests, and that the mandate and protocol as described within Executive Order number 2068 is not necessary. 5, the Board of County Commissioners find that opting out of the statewide executive order gives Coffee County flexibility going forward to make recommendations or mandates, if necessary, that best protect the health and safety of the citizens of Coffee County, Kansas. 6. As a result, the Board of Coffee County Commissioners recommend the following to meet the local needs related to the spread of mitigation of the spread of COVID-19 in Coffee County, Kansas. Social distancing. At the individual level, this means maintaining at least 6 foot distance from other individuals. At the group level, this means canceling mass gatherings where individuals will be in close contact with each other and cannot maintain that 6 foot distance. Infection control measures. Wash hands with soap and water for at least 20 seconds as frequently as possible, or use at least 60% alcohol-based hand sanitizer. Cover coughs, sneeze into your sleeve or inner elbow and not into your hands or openly into the space around you. Regularly clean high-touch surfaces and avoid shaking hands. Wear a mask or face covering when inside public spaces. In line to enter any indoor public space. Obtaining services from the healthcare setting. All businesses or organizations in Coffee County may encourage employees, customers, visitors, members, or members of the public to wear a face covering when employees are working in any space visited by customers or members of the public. Employees are working in any space where food is prepared and packaged for sale or distribution to others. Customers, members, visitors, or members of the public are in a facility managed by the business or organization, or employees are in any room or enclosed area where other people are present and are unable to maintain a 6 foot distance. The Board of County Commissioners find that the need to quarantine is not necessary if both the positive COVID-19 person and the close contact are wearing face coverings, and that a decision to quarantine is to be reviewed and decided at the discretion of disease mitigation staff, investigation staff. This resolution shall be effective upon passage and shall be reviewed by the Commission on December 7th, 2020, and every 2 weeks thereafter. It is hereby ordered by the Board of County Commissioners of Coffee County, Kansas, that Coffee County is hereby exempt from the requirements of the face coverings protocol as set forth in Executive Order number 2068 issued by the Governor of the State of Kansas and as authorized under Section 33 Kansas House Bill 2016 and codified at KSA 2020 sub 48-925H. So ordered this 24th day of November 2020 by the Board of Coffee County Commissioners. So there's a couple things that need to be stricken that I mentioned, but outside of that, that's how it would read.
Lindsay's right, you pretty much have everything in there the governor had, so, correct? I mean,
It just says recommended to the required.
yeah, we're close.
So outside of the changes, are there any modifications or changes or clarifications that need to be made?
Not in my opinion.
Okay. Does that wording meet the approval? And I understand Fred's position.
I would just like to say that I agree with everything that's in there except the word optional and not mandatory. But everything else was very well written and is a good recommendation.
Are we going with the 1201 tomorrow's date instead of immediately, or
Is that what you
if
want?
we go, if we
I
go,
would, just to echo,
To mirror the governor's order,
yes,
12:01 a.m. Wednesday.
well, that'd be Wednesday, wait.
November 25th, 2020. So outside of those changes, I'll need to go and fix that and bring it back, but that won't take long. Is that Anything else?
I don't think so, but we can make a motion to approve this resolution, can we not, as amended?
I'd rather you have the final
Correct.
version of it than have that.
It'd be better not to have the word amended.
Okay, all right.
Does that work? All right, I'll be back.
So it was pretty much decided you're gonna continue conversing with doctors, am I correct?
Correct.
And, have you spoken to Dr. Shaw or no?
I texted him last night, yes.
Okay,
He responded back.
Really?
okay, I mean,
And I think the first years of service, that I was, sad to hear that.
Yeah,
Um,
know.
I let him know we stopped doing all services that were under his license.
That's cool.
Asked if he had any recommendations on who we should have. And he replied that he began doing it when Dr. White passed away and anyone who we thought you might want, so.
okay. I probably will, I mean, it's on my mind today, to reach out to him. And then after reading this paragraph down here, reach out to the CEO as well and give you hopefully some more avenues if needed, or
Yeah,
if
perhaps.
needed, if needed.
Yeah, perhaps. I was thinking further about that, and sometimes we don't know who we don't know the schedule of
I get
the
that.
hospital and know who's on call, so even to know who to reach out to, that might get a little weird.
Yeah,
So it won't be as accessible.
I get it. Okay.
So, yeah. And I think accessible and consistent would be my concern.
But if when we get someone new, if we get one person, they can also designate a deputy for them, right? That if they're not available, you can also reach out to that person.
I would assume so, but of course, the way this reads, to me, that it sounds like
They can designate.
they designate that person themselves. I mean,
Yeah.
They could designate all their doctors, I guess,
one or two,
if
Oh,
that's,
I
if
don't-
that's
I
around the
mean, we
wind.
tried to work that out with Dr. Shell in case he would become unreachable to us. What would we do? And he was like, well, I don't know. What would we never solved it.
Yeah.
We never
Again,
came
it's
up,
been-
yeah.
kind of pretty.
Yeah,
sailing
but
on
he'd
that.
always been accessible to us throughout this, so, we didn't come into that, so. Yeah, so I'll go forward and reach out as best I can.
Beverly Clark, Whiteside.
Travis is a PA, and I don't think he's here anymore.
And,
Oh, really? I didn't know.
and even on this issue, you know, I know you and I were both on opposite sides a little bit,
Mhm.
but I do fully appreciate and support you and your staff, what you fully do.
Thank you.
Oh,
So,
thank you for the work you do.
Absolutely
I
appreciate it.
really do.
Even though I don't quite agree with everything.
I know, thank you very much.
And that goes for me.
I'll say the same thing, just because we don't agree. It doesn't, you know,
Yeah.
I think we're all after the same thing, we just have a little bit different
Way of getting there.
avenue of getting there.
Yeah,
And I think it's put us in a weird place. Normally governments don't make these decisions. You guys were just recently given this power in July with a new law. So before HB 2016, you wouldn't have had the ability to override Dr. Shell, except by getting rid of him. So that's new. Just an interesting, very interesting.
And I think when legislature did that, they had a reasoning for allowing that. I think, and Eric spoke of that yesterday, is a lot of that is to keep it local. What is good for, like the governor mandates for Johnson County, probably doesn't abide by us very well.
Yeah.
It'd absolutely be a difference.
We see that a lot. So many things are made that fit the big cities that don't fit us at all. I mean, we talk about that on a bit. Something just makes zero sense.
We've seen that well, I've seen that in commissions the last few years. Everything that basically is done is for Johnson County, Sedgwick, and Shawnee. Basically, the extent of it anymore.
And Carl, I guess, has stepped out, but they were reporting cases, the White House was giving us weekly briefings via paper. And it was like, I want to say 52% of the cases in Kansas were coming from 3 counties. And it wasn't, I mean, it was the larger counties and they're voting today, or they probably have voted or are in the middle of voting for our high school winter sports. Acacia, as a board, is voting on that now. A 78-member board is voting on whether to,
78 or 80.
yeah.
I know a couple of members that's on that board, and they were even still undecided how they were gonna vote. I won't mention any names at all, but they were still undecided for what was the best direction to go to. They're talking about delaying the athletics until what, January 15th?
Mm-hmm. They said their reasoning was.
It's a tough decision on those 80 people.
Well, with
Right.
this resolution we're gonna pass, mass gatherings, canceling mass gatherings, or
But we don't put a number on that. We
they
said 6
they
feet
still have
apart.
a basketball game, well, they're still 6
6
feet
feet
apart.
apart.
Is that correct?
That's why I don't understand. KU, not gonna let anybody in. You know, they could let a few number of people in there.
Well, they started out 1,500. They moved that, changed that altogether, zero.
It's zero now for
Zero now.
I mean,
For 2
they can still let people in and social distance them.
I didn't know
They
that.
they can tell them, you're gonna wear a mask and social distance, but
It was interesting, there were people reporting today how many cases of COVID were contracted on, was it, Sheila's not in here, was it football or where they had the GPS trackers on,
Yeah.
the players?
Yes.
And they could tell, and no, it didn't pass, and COVID didn't pass to the athletes. And they had another study that students that were actually at home were more likely to contract it than the ones who were involved in activities in in-person school.
But the athletes aren't hugging each other for 10 minutes. I mean, they're contacting their way, now they may bump and contact occasionally, but it's not.
Yeah, it's just so interesting how we're in this weird place where, for people to make medical decisions that aren't medical people, it's just a weird place. So, yeah, we appreciate the support, we really do, and we know that you guys support us, so.
We'll get
We're working hard for you.
we'll get the medical assistant deal out of the way first, and we'll get to the
We
officer.
appreciate you.
Yeah.
But
I think people all across the country are making different decisions. This is the first time in 34 years of my marriage that I'm having Thanksgiving and Valentine's Day.
I will say, I do like your mask, except Tina said back there sticking her tongue out. But those they're kind of different, but
I forget you can see that.
I see everyone doesn't wear those,
I don't want you to see my.
I see a few of them.
but those are,
it's nice to be able to see somebody smile.
Yeah, well, they are hot, they're very hot compared to the other type. But we do the school nursing responsibilities that we do with hearing and vision testing. Katie needed us to get some for that purpose, and so.
It's a little less scary if the kids can actually see our smile
Right, I'll
versus our face.
Yeah.
And when we're giving immunizations, it's nice to smile with them
Yeah.
and kind of help them not be scared.
I will say this with a few things I've witnessed in the last few days, when this mass thing started to get a little more serious, a lot more serious, actually. Some people have a false sense of security with the masks too, because I witnessed an elderly couple walked in the medicine shop and one of them could have handled the procedure just fine. Like,
they're both wearing masks, weren't they?
Yeah, they were.
So, yeah, it's okay to go in.
Yeah.
We've heard that from a group of people that had a private event and everyone wore masks the entire time. But it let them get closer to people, hug and, pretend like they're kissing on the cheek or whatever, when they normally wouldn't maybe have done that. And it did spread.
Mhm. That's why I gave my false sense of security, like this is gonna remedy it, and
Yeah.
you know,
Still common sense.
unfortunately, they don't flow everywhere.
It's hard to find with COVID. We do a lot of weird things.
We must have lost him.
They had quite a few corrections.
Yeah.
Yeah, he had some questions.
Well, you did.
I think this was his day off. I think he had unscheduled and everything for the rest of this week, so he could be on.
He's not here. He's not here.
I don't know whether they're coming tomorrow or not.
Forget me started.
We don't know what his schedule is. I called a bunch of commissioner associates to our county just to see what they were doing.
I haven't called.
One of the counties just said they're not gonna take any action. That was the easy way out. We're not gonna commit to it, we're just gonna let it go, and that means it automatically becomes the governor's, but we don't have to take any responsibility for it. But
You said Anderson County knocked out?
Anderson County opt out.
You know, as many,
Just don't make a decision.
as many active.
If you don't make a decision, yeah, it takes effect.
That's what you're all-
Yeah. That's not quite right. Yeah, I talked to the last meeting, he said that they adopted that. He said he had about 50 people in the meeting yesterday, he said,
Okay.
at one time he counted, there were 29 people, 4 opting out and 14 against.
Yeah, like I say, most places I went today,
Okay, I only had 3 calls, all 3 of them didn't want to stop out, that's just 3.
I haven't had any calls, and I'm here to you.
I normally don't get many calls, but I have had 3 of them.
I had some
yeah,
phone
that
calls.
just beats those, it does one day.
Lynn County opted out, Osage County opted out. Well, in a sense, if we didn't opt out, we still got these surrounding counties, they come into our county, so have we gained anything? Maybe not, I don't know. It's a tough decision, and
I haven't heard anything on Allen County. Allen, Oregon.
the only thing I see is that this said recommend instead of require, and I'm good with that. This is one of the times it could be a 5-board commission instead of 3.
You definitely get more ideas. Sounds like it's on the way.
There he is.
Sorry, I had printer issues.
Don't
make me. Funny, remember?
I mentioned, I thought you got lost, William.
I was told.
You were told we thought you got, Don thought you got lost?
Me, you ran out of ink.
Run out of energy, that'd been me.
For me, it's always the. Change my portrait.
You can take tomorrow off?
Unless something else comes up.
Hopefully we'll let you have, you can have tomorrow off.
Do we have Thursday and Friday seasons?
Oh, yeah, let's go all the way.
Sure.
Let's take yours.
This auditor will take care of everything. My eyes work. And I got sweat running down the road.
I don't think that would manage, you don't have to shave it off.
That's a good thing, 'cause I don't like shaving.
Maybe that's what pulls them down too.
Good?
If that needs your approval, I'm not gonna read it again.
No, it
I
does.
think it's okay.
I made the corrections, I added the resolution number.
Good.
That's if it says what you want it to say, then
That's all right. Everybody agree? So, need a motion to pass resolution 2020-863 as written.
That motion.
I'll second it.
Tim made the motion, Bob seconded, all in favor say aye.
Aye.
Aye. All opposed?
Aye.
Motion passes 3-2.
I have the original.
You need to sign the original.
I have the original.
Tom has the original, he's the chairman. And that's the one everybody else can sign.
I do have.
While everybody's signing that, so the topics that were to be covered in this special session, one was the governor's order and this resolution. The other topic was the local health officer / health department, that particular issue. I think there's at least a tentative plan moving forward. You just need to make sure that that is on your mind and that it's handled as expeditiously as possible to make sure that somebody's in place to fill that role. So outside of that, I think that's the only thing that can be discussed and talked about today. So that's all I have. Again, thanks for meeting on such short notice, but as you see, it was important that this meeting occurred and take place as soon as possible.
Thank you for all the work you
Thank
do.
you, Wade. Thank you for spending your time off with us. I recess at 4:37 till tomorrow morning at 9 a.m.
Question on that. This was a special meeting. We already recessed to the regular meeting for yesterday, from yesterday to tomorrow, so it's just, there's a special meeting adjourned and the recess still in effect for the other one.
That is a good question.
We've never had this before, Tom.
When I started, I said, well, we're back in session at 9 o'clock here today, so I assume we recess again till tomorrow morning.
I'm okay with that.
Yeah, I don't care, it's just however we need to do it.
I think all efforts were made to comply with what the requirements are.
Good enough.
All right,
This is-
I'm good.